As we welcome 2025, Humanity and Inclusion would like to celebrate a year of accomplishments, learnings, and growth. 2024 has been very challenging, especially for the communities battered by multiple cyclones, perpetual flooding, and displacements due to natural and human-induced crises. However, these challenges have only made us more determined to reach the most vulnerable and most at-risk communities. We work hand-in-hand with them to provide timely and appropriate life-saving assistance, assist in the road to recovery, and support them and the local government units in developing sustainable and inclusive solutions towards protection, risk reduction, and health and prevention. These efforts were only possible thanks to the contributions of our donors, local partners, consortium collaborators, organizations of persons with disabilities, volunteers, and staff. Together, let us reflect on the milestones we have collectively fulfilled. Protection and risk reduction. Families affected by conflicts and disasters receive cash support, food assistance, and essential supplies for hygiene and health. Displaced households have access to wash promotion, hygiene kits, water kits, community cleaning kits, and latrine repair tools along with sleeping materials. Communities access medical referral support, ensuring health needs were met. Vulnerable communities exposed to armed conflict have established and mobilized local protection monitors, enhancing community-led safety and security. Organizations of persons with disabilities led initiatives to strengthen community resilience to climate change. Young people developed skills to advocate for inclusive climate action. Foundational studies and mapping exercises are produced and disseminated to generate evidence on inclusion in the current early action models. Gaps found then inform the future development of early action protocols or EAPs by HI. EAPs are also developed with emphasis on enhancing outcomes about inclusion and needs-based support for the vulnerable population. Capacity building, knowledge building, and technical assistance activities were carried out to foster inclusive local practices on anticipatory action. In the Bangsamoro region, inclusive climate action plans further reflect meaningful community engagement and evidence-based strategies. Most at-risk communities were also trained on disability, gender, and age inclusion and disaster risk reduction and humanitarian action. Lastly, protection and inclusion principles were integrated into disaster preparedness and response policies and plans of partner LGUs. Health and prevention. Communities in flood-affected areas strengthened disease prevention and vector control strategies. Barangay health workers and municipal teams were trained in disease surveillance and inclusive disaster response. A digital reporting and mapping platform for disease surveillance was also developed to assist in creating a more efficient health system. Municipal health workers were trained on inclusive disaster risk reduction and anticipatory action. Persons with disabilities and older persons were provided with assistive devices and reasonable accommodation to ensure access to disease prevention activities and risk communication messages. Local healthcare professionals were further capacitated to diagnose and manage type 1 diabetes and provide youth-friendly and disability-inclusive care. Children and young people living with type 1 diabetes were also able to have access to insulin, blood glucose test kits, and other medical supplies. As we look back on 2024, we acknowledge the challenges faced and the progress made. These achievements were made possible through the dedication of everyone involved. This 2025, HI will continue to work alongside persons with disabilities and other vulnerable communities to build a world of solidarity guided by our values of humanity, inclusion, commitment, and integrity.
Welcome 2025!